Hey, what's up guys? This is Sam with the Nursing Channel. So I just got off my 8-hour shift. I obviously work as a case manager, and I'm making this video in direct response to Teddy Cookwell, my man Teddy Cookwell, who's just subscribed to my YouTube channel, and he had a few questions regarding case management. It sounds like he just got offered a case management position. He currently works in the OR right now as an OR nurse, and he's wondering whether he should take the position as a case manager or if he should just stay in the same capacity that he's working in right now. So, and then one of the questions that he directed towards me was, what are the downsides to doing case management? So I'm just going to be straight and cutthroat with you guys, just give you guys the nitty gritty, just be truthful and honest with you guys. Case management for me has been wonderful. And I'm not saying this because I'm a case manager. I'm not trying to be biased or anything like that. But when I started my career, I started working as a med-surg nurse. And so on the med-surg floor, you have 5 patients and you have to give a whole list of medications to each patient. And you have to deal with all the emotional stress, the physical stress of having to lift patients up from the bed onto the bedside commode, or assist them to the restroom, or roll them over to get them off the bedpan, or change pressure ulcers that might be on their backside. And then also you deal with patients that are angry and just being verbally abusive towards you. So as a nurse that does direct patient care, you deal with emotional stress, you deal with physical stress, you deal with mental stress, which is probably the same thing as emotional stress. But anyways, you deal with that stress, and then you deal with the stresses of family members with their tons of questions asking, why is my family member getting so-and-so, and why hasn't the doctor spoken to us yet? So you get all this, all these outside stressors on top of the stress that you're already dealing with as a floor nurse. The nice thing about case management is you're only dealing with basically with one side of things in the large spectrum of the care of the patient. So I'm just mainly dealing with discharge planning. So once the patient leaves, what are the things they need leaving the hospital? Patient just got newly diagnosed with COPD. They're gonna need oxygen for home. Let me call up an oxygen vendor and see if they can issue an oxygen machine, deliver it here to the hospital. That way the patient can take it upon discharge and have their oxygen. Is the insurance gonna be able to cover the cost of the oxygen machine for the patient? So these are questions you have to ask yourselves. Will the oxygen machine fit inside the vehicle that the patient's going to be transferring in to go home? Or should the oxygen machine be delivered to the patient's home? Is somebody going to be at the patient's home to be able to receive this oxygen machine? So these are questions you have to ask as a discharge planner, as a case manager. Other questions you might ask is, so the patient just got off of a knee surgery or a hip replacement, and the patient's he's beginning to mobilize again. He's working with physical therapy, and physical therapy says, hey, the patient's not quite ready to go home yet. Maybe we should send him over to a skilled nursing facility where they can get continual physical therapy treatment and help. That way they can get more physical therapy and be able to get back to their baseline and be back to their normal self where they were ambulating and walking on their own at home. So these are questions you have to, try to answer before the patient discharges home, because you don't want to send a patient home who's not ready to be in the home environment just yet. So the nice things about doing case management is that you're not dealing with medications. You're not dealing with poop, urine, feces, bad smells like C. diff. That's a nice thing. Also, you're not dealing with as much verbal abuse from patients or family members, because your interaction with the patient is short compared to the interactions that the bedside nurses have with the patients. Another nice thing is, as a nurse case manager, since you're not giving medications to a patient, there's no risk you don't run the risk of hurting or injuring the patient by accident or by negligence. So you can't, in other words, you can't kill a patient because you're not dealing with these harmful chemicals that if you draw up the wrong dosage, you can potentially hurt a patient. So that liability and that risk goes out the door because you're not dealing with medications or harmful substances. You're not administering any of these to the patient. So that's nice. So you're not a threat to the patient, as opposed to a nurse that does direct patient care. If she draws up the wrong dosage of morphine, and gives it to the patient, they can potentially put the patient at risk of, respiratory failure, knock out the respiratory drive. So that's the nice thing about doing case management, that you're not a harm to the patient. That the worst thing that can happen to you as a nurse case manager is that maybe the patient doesn't get discharged on time. Maybe, the oxygen vendor forgets to deliver the piece of oxygen equipment to the patient at the bedside. And so now the patient can't go home until they receive that piece of equipment. And so maybe the discharge is delayed by one more day. So that's the worst thing that can happen as a case manager. So that's pretty nice, So downsides to doing case management is that maybe your role as a case manager is dependent upon other people, such as maybe like a medical equipment vendor. Like I said, if they don't deliver the piece of equipment that the patient needs to discharge, maybe you did all that you had to do. Now it's dependent. The discharge of the patient is dependent upon whether the piece of equipment gets delivered to the patient. So you have a lot of relationships that you need to establish with other people to make your job as a case manager work out. Like I said, a case manager is cool. It's nice. It's more of like a desk job. It's more like helping coordinate care, like behind the scenes, getting certain forms signed, calling patients' family members just to make sure that they're available as a support to the patient once the patient goes home, arranging transportation, knowing the basic information regarding insurances such as Medicare, Medi-Cal, being aware of the various resources in the area that are available to the patient. Like, let's say the patient needs to go to a shelter. Maybe they're homeless and they need wound care. They're not going to home health nurse isn't going to be able to assist the patient with wound care if they're out in the street and they don't have a address to go to. So if you can send the patient over to a shelter and be able to provide establish home health, have a home health nurse go to that shelter and help the patient with the dressing changes for the wound. You can do stuff like that. So as far as case management, I like it. It's a cool job. I still feel like I'm helping the patient, even though I'm not at the bedside administering medications or helping manage their pain. I'm still helping them in a different aspect, making sure that they have all the resources and the equipment that they need before they go home, or at least we set up whatever facility they want to go to or they need to go to get the medical services that they need upon discharge. I would say another downside, which is probably not really a downside, but in a sense it could be a downside to doing case management, is that you don't get as much thanks from like the patient or the family members, because you're not with the patient or the family as much as you would be if you were working as a floor nurse. As when I was doing a direct patient care as a med-surg nurse, I would get a lot of thank yous, and I'm just appreciative of the help and the support you've been with me. Like you were able to take all my crap, and you were still respectful and kind and nice, and you still treated me with integrity. And so for that, I want to thank you, Sam, because you were just an excellent nurse, and I won't ever forget that experience. I've gotten a lot of thank yous and a lot of grateful patients for the care that I've delivered to them. So as a case manager, you're not with the patient as much, so you might not be getting a lot of thanks or gratitude for your work. But I mean, I still have patients every now and then just be grateful for me setting up the services that they need, getting them the equipment that they need on time so that they can discharge and be with their family members and whatnot. So, I mean, those are honestly the only 2 downsides I could think of if you look at them as downsides. But for me, transitioning from doing direct patient care to case management, it was just like a breath of fresh air, because I'm just like, I can't hurt the patient, you know, giving them these harmful meds, but I can still take care of the patient in a different way, making sure that they have all their discharge needs taken care of. And yeah, I mean, if you guys have any other questions, feel free to comment below. If you like this video, give it a thumbs up. If you don't, give it a thumbs down. Hey, I welcome everything as long as it's an honest answer. And Teddy Cookwell, I hope this video helped you out. Like I said, I didn't plan on saying what I just said. I just came off work and I'm just giving you my honest response to your question. So I hope this helps and it helps you make a decision. Keep me posted on whether you're staying in your OR position or you're going to take the case management position. Also, I just want to add, the nice thing about case management is that, so real quickly, it's going to be a little tough once you transition into your case management position in the beginning, just because you're going to hear a lot of words and terminology that you haven't really heard about as a nurse, because it's a completely different aspect of nursing that we weren't taught in nursing school. So yeah, it's a learning curve. I'd say like about, if you stay in the position, if you do decide to take the position, if you stay within the position 6 months, you'll start getting comfortable, getting familiar with the terminology. And then I'd say about 6 months to a year, then you'll start really getting comfortable with case management. That's how long it took me to feel comfortable as a case manager. And now I feel like it's just a breeze, like it's a walk in the park now. But in the beginning, yeah, it's going to be kind of strange for you hearing terms like Code 44, Medicare Part A, Medicare Part B, Part C, Part D, 2 midnight stay or 2 midnight rule. You're going to hear words like observation, inpatient. You're going to hear different resources that we use, like InterQual or I forgot what the other one's called. You're gonna do stuff like utilization review. So all of this stuff is gonna be new for you, or you're gonna hear Code 44, stuff that you obviously just gotta read up on and kind of like absorb that information. And once you get all these words and terminology down, and you start getting familiar with how discharge planning works, it's just gonna be a breeze. It's gonna be a walk in the park, and it's a cool job because it's a structured job. But there's also like things that can change throughout the day. But once you get the whole gist of it, it's pretty much the same. Yeah, I enjoy it. I like it. I plan on staying in this capacity for a while. I don't see myself going back to direct patient care. Yeah, so I hope this helps. Like I said, if you decide to go into case management, don't be intimidated in the beginning when you start hearing all these words and terminology being thrown around. Like for me, starting, it was just kind of daunting and intimidating. I was like, what the heck are these people talking about? Like, I'm completely lost. But yeah, with time, you'll just start picking up these words, absorbing them and understanding them. And in about 6 months to a year, I would say, you'll really start getting comfortable, and then you'll just become like skillful in case management. You'll be a master. So anyways, hope this video helps. I'm out. I gotta make some food. I'm super hungry. Just came off of work, 8 hours shift, and I need to fill this belly. Hope this video helps.